Hello, everyone joining us, and welcome to One Health Approach to Risk Assessment, which is the ninth of the Surveillance Advances seminar series, co-hosted by the Public Health Agency of Canada and the National Collaborating Centre for Infectious Diseases, or NCCID. My name is Wendy Xie, and I'm a project manager at NCCID. I'll be one of your moderators today, along with Elisa Jiang, who is an acting, Elisa, I'll let you introduce yourself later. But Elisa is from the Public Health Agency of Canada. NCCID is funded by the Public Health Agency of Canada to provide knowledge and evidence for use in public health planning, programs, and policies related to infectious diseases. We are incredibly excited to be co-hosting this series with the agency. I would like to acknowledge that NCCID is hosted by the University of Manitoba, which is situated on Treaty 1 territory, the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and is the homeland of the Métis Nation. I'm joining this seminar from the unceded lands of the Anishinaabe Algonquin Nation. As an organization, NCCID recognizes that treaties have been implemented as a part of the process of colonization intended to benefit some while harming others. We are committed to working with our partners towards reconciliation and justice as we strive to honor the lands and their original caretakers in our work. So before we dive into today's seminar, there are just a couple housekeeping items I would like to mention. First is that a recording of this seminar and the presentation slides will be available shortly after the seminar on the NCCID website. You can find that on nccid.ca under the webcast tab. The chat box for participants has been disabled for this session, but we'll be using the chat box to communicate additional information with everyone. If you have any technical problems with Zoom during this seminar, please email us at nccid@umanitoba.ca and we'll try to help you out. If you have topic-related questions, please feel free to leave them in the Q&A tab throughout the presentation, and we'll try to address as many as possible in the discussion period after the presentation. You can also like any of the questions that have already been posted there to push them up in priority. Surveillance Advances is a Section 1 self-approved group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. The seminar series is also approved by the Council of Professional Experience for Professional Development Hours for members of the Canadian Institute of Public Health Inspectors. So if you require a letter of participation, please look out for the survey that will be shared after the seminar.
Thank you, Wendy, for covering some key housekeeping items. My name is Lisa Jiang, and I'm an epidemiologist within PHAC's Data Surveillance and Foresight branch. Welcome and thank you for joining us today. Bienvenue, merci de vous joindre à nous aujourd'hui. While today's seminar will be delivered in English, we welcome everyone to pose their questions in their preferred choice of their official language in English or French. N'hésitez pas à poser vos questions en anglais ou en français. I would like to take this time to acknowledge the land that I live and work on, which is also situated on Treaty 1 territory, the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and homeland of the Métis Nation. I am grateful for the opportunity to share and call this place home. We honor the Indigenous people who live and have provided stewardship over these lands for generations. Today, we have participants and presenters joining us from coast to coast to coast. The land in which you all join us from represent the lived experience of many Indigenous peoples, all with their own unique health story. We would like to acknowledge that the practice of public health surveillance may raise concern for Indigenous people and other communities. To public health practitioners, surveillance is a core public health function and is fundamental to protecting and promoting the health of populations, guiding evidence-based decision-making, and addressing public health challenges. But for others, surveillance may carry negative connotations about security, privacy, and control. For this seminar series, we would like to note that we use the word surveillance to refer to the assessment of and response to public health threats. Lastly, this seminar series is not just about the speakers and organizers, it's about you, the audience. Your active participation, questions, and perspectives are vital to the success of this initiative. We encourage you to engage in discussions, ask questions, share your thoughts, and foster collaborations that can lead to improvements in public health surveillance.
Thank you so much. And now I would like to introduce and welcome our speaker for today. Dr. Sharon Calvin is a veterinary epidemiologist who is currently the head of One Health Risk Assessment at the Center for Surveillance, Integrated Insights, and Risk Assessment of the Public Health Agency of Canada. She has worked in wildlife health, domestic animal health, and public health in Canada. Her expertise is in risk assessment, epidemiology, zoonotic diseases, and One Health approaches. Dr. Calvin worked for 11 years as a risk assessor at the Canadian Food Inspection Agency, often focusing on risk assessment at the human-animal interface. She recently worked for the Food and Agriculture Organization of the United Nations, leading efforts to characterize the risk landscape for the quadripartite One Health Intelligence Scoping Study. A huge welcome to Dr. Calvin. We are so happy to have you join us today, and we're excited to learn about your experience and knowledge in One Health. So I'll pass the mic to you.
Thank you so much for the introduction and for the invitation to be here today to talk to you about my favorite subject, One Health approaches. I'll share my screen. Okay, well, hello everyone, and I would like to start by acknowledging that I live and work on the unceded traditional territory of the Algonquin and Anishinaabe people. So we have been working for a couple of years now on developing a framework that we call OHARO, which is a One Health approach to risk assessment. And it's very specific to risk assessment, but I thought that some of the lessons that we've learned in the development of this framework would be applicable to other One Health activities such as surveillance. And so I will start by just saying that I have no conflicts of interest to declare. In terms of learning objectives for today, I hope that by the end of this presentation, you'll have an understanding of the scope and the importance of One Health, that you'll be able to recognize challenges to multi-sectoral work and some best practices for overcoming these. And then finally, I hope this presentation will foster the ability to think outside of organizational mandates for the sake of the greater good. And so I'll start by providing some recent background on international One Health activities. The COVID pandemic really stimulated a wave of international activities related to One Health. So for example, in May of 2021, the One Health high-level expert panel was launched. So this is known as OLEP. You might hear me just saying OLEP for the rest of the presentation. And they've done many activities, one of which was to define One Health, which seems like a really simple thing to do, but I think is really important, and I'll go into that more later. In March of 2022, the tripartite, so that was the World Health Organization, the World Organization for Animal Health, and the Food and Agriculture Organization, they became the quadripartite by bringing on board the United Nations Environment Program. And I just wanted to put in here a little plug for the project that I worked on when I was working for FAO, was the quadripartite One Health Intelligence Scoping Study. So the results of that were released in August of 2022. In September, there was also the release of the multi-sectoral coordination mechanisms operational tool. So that's a useful tool that provides some guidance on coordination mechanisms. And then in October, the quadripartite released the One Health Joint Plan of Action, which I'll also discuss in more detail. So why is One Health important? A few recent resources, including a CIHR paper, they highlighted that we really need the capability for early detection. So that's sort of where the surveillance and monitoring comes in. Understanding, which is where the risk assessment piece comes in, as well as action to address One Health threats to reduce their potential wide-reaching impact on human, animal, plant, and ecosystem health. And among other things, One Health, it plays an important role in the prevention of pandemics. And so it's been highlighted by the WHO in their pandemic instrument. And then, as I mentioned, the One Health Joint Plan of Action that was released by the quadripartite. It has 6 action tracks. So track 1 talks about enhancing capacities and strengthening systems. Tracks 2 to 5 look at different types of hazards that we often associate with One Health. So emerging and re-emerging zoonotic epidemics and pandemics, zoonotic, neglected, tropical, and vector-borne diseases, food safety risks, and antimicrobial resistance. And then action track 6 talks about really integrating the environment into One Health, which is an important piece. And so what is One Health? As I mentioned before, the OLEP panel, they came up with this definition. So One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And so that's important there, that it's not just people, it's people, animals, and ecosystems. And I'll go into this in a little bit more detail. It recognizes that the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. And it mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats, not only to health, but also to ecosystems. And so you'll notice that this definition, it really has an ecocentric perspective. And when they released the definition, they specified this in particular. And just to describe that a little bit more, anthropocentrism, it would really see, it would maybe look at One Health perspectives, but always thinking back to how they affect human health. Whereas ecocentrism, it considers all living beings and non-living things in nature to have their own intrinsic value. And so this definition looks at One Health from all of those perspectives. And so you could probably see with a definition like this that One Health has a very broad scope. It includes multiple different types of hazards. All of these hazards are occurring in complex systems. And one of the activities that we tried to do with both the quadripartite and in the development of our OHARO framework is to try to think of examples of these types of hazards to help give people an idea. And there's many different types of hazards. Which ones you're looking at will depend on your perspective, your risk question. So that's sort of the diagram on the right that's represented by all of the marbles there. But just to give some examples, we can look at, for example, biological hazards, and many of us were very familiar with those. So they might be things like zoonotic diseases, AMR organisms, animal diseases, plant pests. There's also chemical and radiological hazards. So for example, contaminants in food, air contamination, water contamination. There are meteorological or hydrological hazards, so extreme temperatures, wildfires, storms, and floods. Or there's environmental hazards. So for example, habitat degradation, resource depletion, increased erosion, or loss of nutrient cycling. The term One Health, it was often historically focused more on human and animal health, with other terms like ecosystem health or planetary health focusing more on the environmental aspect. But recently, especially with this new OLEP definition, there's been a push to include the environment more into One Health initiatives. And this was an example of this was the quadripartite held this meeting last year. they called it Breaking Barriers, Advancing the One Health Agenda with a Focus on the Environment. And I found this little blurb on LinkedIn where they were talking about the meeting, and they talked about issues of pollution, soil health, forest health, management of invasive alien species, impacting food security and global biodiversity. And so basically they were saying that One Health, it's so much more than zoonoses and AMR, which is what we've sort of traditionally thought of it as. So now that I've talked a little bit about the importance and the scope of One Health, I wanted to cover some of the challenges of multi-sectoral working. And I'm sure many of you are familiar with these challenges. These are some of the things that were raised during the development of our framework. And so there's a lack of federal leadership and coordination, which tends to result in silos. And there's what we think of as the traditional silos between sectors, so human health and animal health. But even in some cases where these sectors have started working together, it may still be siloed in terms of disciplines. So people may be working together, but specifically on emerging zoonotic diseases, and that might be somewhat siloed from the people working on food safety issues, and that might be somewhat siloed from the people working on environmental issues and climate change. So there's still a lot of these silos happening, and it really takes a lot of coordination. Second, the collaborative mechanisms, they often tend to be slow. And so that's not always helpful in emerging situations. Third, One Health issues, they tend to be complex issues with high uncertainty. This requires complex methods, methods for surveillance, methods for risk assessment, as well as inputs from multiple sectors. And fourth, there's often a lack of ongoing consistent capacity for scientific and technical work in certain areas. And some areas have lots of capacity, other areas maybe not so much, like for example, risk assessment related to wildlife health is often struggling for capacity. And then fifth, and I'm sure everyone's very aware of this, different mandates and priorities between the organizations. In some cases, there's overlapping mandates and duplication of work. And in other cases, there's gaps and topics that don't fit clearly within any department, that sort of fall through the cracks. So there's all of these challenges, and to address these challenges, we highlighted some best practices. Many of these were raised by partners throughout the development of our framework. Some we gathered from the literature as well. And so this is a placemat that we use within our framework, but I thought it would be applicable for thinking about surveillance as well. And so one of the best practices is very important. It's awareness and engagement. And so One Health approaches, they require political will to succeed. And so the value of a multi-sectoral approach, it has to be communicated and understood widely so that all sectors can embrace it and implement it. And it needs to be understood at a high level so that the people at the technical level, they have the ability and freedom to do this collaborative multi-sectoral work. Another important piece is to have networks. So building trust and relationships, it takes time. Therefore, it's recommended to establish multi-sectoral and multidisciplinary networks in peacetime so that you have these networks there when a crisis happens. And so this requires activities to be organized regularly to bring partners together. Another important piece is methods. So as I mentioned, One Health, it tends to be very complex. We have a large portfolio of methods for risk assessment, but also for surveillance. And these need to be available to different people. And also we can learn from each other, learn from the different methods that are used across different disciplines and different sectors. And that kind of gets into the training piece as well, that One Health, it will only really work if each sector involved has strong and adequate capacity. Documentation is also an important piece in that partly to reduce duplication, to know what the different sectors and different disciplines are working on. It's important to document the discussions that are had, the decisions that are made. And I think we all know how hard it is just to keep corporate memory within a sector. People move around, they retire, but then having that corporate memory across sectors as well is very important. And so the documentation has to be done in a way that's accessible to all partners. It's important to think about agreements and what agreements are needed, either formal agreements or informal agreements, sometimes for sharing of information. At other times, agreements might be needed specifically for the collaborative work. And then finally, just evaluation is an important piece to consider. The challenges and conditions associated with a One Health approach. They'll change over time, so it's important to build that evaluation piece in so that your approach is regularly evaluated and updated. So for the third objective for today, which is thinking beyond organizational mandates, I wanted to spend a bit of time to describe a tool that we find very helpful in risk assessment, but it can also be helpful just for systems thinking in general. And so that's a risk bow tie diagram. And it's really a tool for illustrating risk pathways, both before and after an adverse event. It's used in high-risk industries, has been used for decades, but we're noticing that its application in environmental and health issues has been increasing. And so it has the drivers or the causes or the threats, whatever you want to call them, on the left-hand side of the diagram, with the pathways leading to the central adverse event. And then you have the pathways leading to cascading set of impacts or consequences on the right. And you can identify along those pathways on either side the barriers. So for example, prevention measures or recovery measures. And you can identify where on the risk pathways they lie. It's also can be used for identifying monitoring points. So if you want to try to map out where your monitoring points are having an effect on the risk. So for example, they might be very upstream monitoring points affecting like very upstream of the central adverse event, or maybe they're monitoring sort of more after an event has happened. But these risk bow tie diagrams, they can be useful to illustrate different sectoral perspectives. So for example, in the diagram on the left, we see that at the top, one sector, they might be thinking of the central adverse event as a disease event. And maybe they're looking at all of the different drivers and causes of that event, and they would include things like loss of biodiversity and climate change. And then they look at various impacts of that disease event. And then maybe they bring in their environmental health partners, but it's important for them to recognize that their environmental health partners, they may be seeing some of these things like loss of biodiversity, climate change as their own central unwanted event with their own lists of potential drivers and potential impacts. And so this can just be helpful in communication to understand each other's perspectives, and when you're working on an issue, to really clarify what you're talking about in that particular case, in the risk assessment world, to identify the specific risk question that you're looking at. But it can also just identify the linkages. And so you can have, as you can, I bet, imagine that quite complex systems and sort of bow ties cascading to other bow ties, etc. And so on the right hand side there, you can see that bow ties can also be used to help describe what we mean when we talk about the intersection of human, animal, plant, ecosystem health. So we're often saying that in the One Health world. And what do we really mean? The bow tie in the middle on the right there, it describes a situation that I think would be more typical of One Health, that everybody would recognize as a One Health issue, because the drivers on the left-hand side, they're different colors there, representing that they fall within the mandates of different sectors, and the impacts may also fall within the mandate of different sectors. And so everybody sort of recognizes this as a One Health issue. So for example, a zoonotic disease might fall within that category. But then you have other situations like the bow tie at the top on the right, where the drivers are all falling within the mandate of one sector and the impacts all fall within the mandate of a different sector. And this could be more challenging. The sector that's feeling the impacts, they don't necessarily have all of the information they need or control the surveillance and monitoring of that potential adverse event. And likewise, the sector that has the mandate for the drivers, they may not be seeing the impacts, so they might not recognize the importance of that risk. And then you also have situations like the risk bow tie on the bottom, where you could have your drivers and your short-term impacts all falling within a single sector. And so it seems like an intrasectoral issue. An example of that might be African swine fever, and where people are thinking, well, the virus is only affecting animals, it's not affecting people, so it's not a One Health issue. But then when you start to look at more longer term impacts, you realize that those are affecting multiple sectors. So for example, if you have a very large African swine fever outbreak and it's eliminating half of the pigs in a country, that starts to have major food security impacts and other impacts like that, it becomes more of a One Health issue. And so in conclusion, I wanted to end by saying that One Health approaches, they really require awareness, endorsement, and a willingness to collaborate by all partners. And so for senior management, this means that they have to agree for their technical staff to participate, to be aware that it may at times require effort from their technical staff that's outside of the traditional mandates of their organizations for the sake of the greater good. And the technical staff have to be willing to share, to consult, and to collaborate from the early conceptual phase of an initiative, which is not always easy. It means sometimes that it's more complex, but it often prevents a lot of headaches later on. And also to appreciate and learn from others' perspectives. And then finally, that One Health approaches, they're not easy and they require ongoing efforts. It's hard to do this off the side of one's desk. You need those ongoing efforts to maintain networks, to advance methods, to help train each other, and to document activities and decisions. And so that's it for me. I just wanted to say thank you and happy to take any questions.
Thank you, Dr. Calvin, for your presentation on One Health approach to risk assessment. We're going to move into our discussion period now. We invite everyone to ask any questions you have for our speaker in the Q&A tab. Everyone is welcome to participate in the conversation. You're invited to ask the questions in your choice of the official language. We will try to address as many questions as possible, but we may not get to all of them. We do have a question already in the Q&A box for you, Dr. Calvin, which I will read out. Does your One Health work focus on the general population or more inclusive? How is Indigenous representation integrated into your work?
Thank you. And it's more inclusive, but I think one of the main things with our framework is that it has a process before a risk assessment ever occurs that's very, very important, which is your risk framing and doing that in a multi-sectoral way. So setting up what your risk question is, who's impacted, what impacts you're going to look at, setting up all of those different pathways, and I think like really looking at the scope of the problem. And so that should be done on a case-by-case basis with the appropriate people at the table. So I think, we say that it's very important to include all of the appropriate people at the table very early on, so that you can get your scope appropriate before you get into the technical work.
Great, thank you. We've got a couple of other questions that have just trickled in here. The second question here in the Q&A box is, what strategy operational changes have been seen at PHAC and or partner organizations following the release of the framework? If nothing yet, what do we wish to be implemented?
Thank you. It's actually not released yet. We're very, very close. So I can't necessarily say for sure, but we are hoping to bring the framework to a high level. And there is a Deputy Ministers Committee on One Health that has representation from many, many different departments. And so we're hoping that that's a good high level place to get that engagement from multiple players at the high level. And then I feel like, I have a lot of hopes for for how this will hopefully be operationalized in terms of an ongoing network and getting people together regularly to advance joint methods for risk assessment and things like that.
We've got another question here. Can you share some successful examples where the One Health approach has significantly improved outcomes in both human and animal health, and what key factors contributed to these successes?
Sure. I think it's still early days for us, but we have been piloting this type of approach regarding avian influenza, and so we've been working jointly with across multiple different sectors to assess the various risks. And I think that has been very successful in terms of having everybody at the table early on, being able to get the appropriate information quickly, which has been very useful, because if we're doing, like, for example, we've done a rapid risk assessment, and if you're doing a rapid risk assessment, you don't necessarily have the time to do, extensive systematic literature reviews. And so having those experts from the different sectors and disciplines at the table has has brought that expertise and knowledge to the table. So that was very useful as well. We've made some recommendations based on the risk assessment, and the recommendations affect multiple sectors. So having those sectors there at the beginning has made them more likely to accept the recommendations coming out the other side from that. And yeah, so I hope that we'll continue to see those.
Great, thank you, Dr. Calvin. Lots of other questions in the Q&A box here. How are the impacts across different sectors determined? It seems the scope can become so large and nebulous. How do you determine which impacts matter, / how can they be quantified?
That's a very good question. I don't necessarily have all the answers yet. Looking at impacts is one of the priorities for methods development that was highlighted during the development of the framework. So we hope to have more seminars and workshops on that to bring people together. There's lots of different ways of assessing impacts, especially like to bring the environmental risk assessors to the table to see how they're assessing impacts, how that compares with public health and animal health. So I think I don't necessarily have a really good answer for you yet. A lot of work needs to be done. In terms of, sorry, just to say, in terms of which impacts you look at, that's something that you should set up with your multi-sectoral group when you're doing your risk framing before you start into the technical work. So based on the concerns that everybody's brought to the table and the risk question that you've set up, that will determine which impacts you're looking at for that particular assessment.
Just going to pull up my handy questions here that we have from our guest. How do you generate interest funding in One Health approaches that solely deal with non-human health?
That's also a very good question. I know that what I've seen often in the past is environmental agencies pulling things back to the human health impacts in order to get that acknowledgement and funding, because it's hard to get the attention otherwise. So yeah, I don't know that I have a really good answer for that, but I hope that, I know that since COVID, there's been a lot more recognition of the fact that there's connectedness between human, animal, environmental health. And so the more we can tie into those past experiences, probably the better. The more we can provide concrete examples to the people with the purse strings, the better.
Thank you very much for that. We've got another question here, and I think, we've got a lot of practitioners and students on the call as well. So someone had noted, any skills you note are rare but important for those looking to work in One Health?
Yeah, that's a good question. I think an important skill is just being willing and able to talk to other people, to collaborate. And I don't know how you teach that, but I think that's such an important part, is just having an open mind and being willing to hear others' perspectives and learn from others' experiences and their methodologies, not just kind of getting stuck in your own tunnel. I think that's kind of the biggest one. I mean, there's lots of sort of micro skills, depending on what different area you're going into.
Yeah, and maybe just to kind of, tack on to that, Dr. Calvin, I'm wondering if you could actually speak to if there's any current training or capacity building opportunities for public health professionals to support a One Health approach to risk assessment that you're aware of.
I mean, I know that there's different, the public health agency and other agencies have different agreements with different student arrangements for students to come and do placements. So that's definitely one. I know that there are lots of training opportunities, for example, at the different veterinary schools across the country. And I think we need more. I know that there are people working very hard on this, especially in academia, trying to increase our training in One Health.
Thank you. We also had a question here come in en français, so I'm going to actually just read out the translated version. In the Canadian context, where discussions between different pillars of government on health jurisdictions are frequent, would you have any tips or strategies to share to mobilize the federal and all provincial governments to work together in the One Health approach to risk assessment? Happy to repeat that. I know I went through that fairly quickly, but yeah, over to you.
So strategies for specifically like for provincial and federal to work together, was that the question?
Yeah, it was to any tips or strategies to share to mobilize the federal and all provincial governments to work together in the One Health approach to risk assessment. So both.
Yeah. It's a good question. I mean, I've been kind of working a little bit on One Health for 16 years or so. And I know a lot of other people have as well. And it's been hard to get a lot of buy-in. I feel like COVID really stimulated a lot of activity. But I also have found that just working on a specific topic. So I happen to know risk assessment. So I kind of thought, okay, well, we may still be trying to figure out how we work together at a high level. But in the meantime, I can kind of work at this technical level and try to sort of start from the bottom up a little bit while other people are working from the top down. And to just try to figure out at a technical level, how do we do this? And I find that that's been like a lot of people have just been very interested in that, and that's been starting a lot of other discussions, and we've been taking this technical work to various tables, which is I think stimulated people to think more about the bigger question. So I guess one technique there is to just start working on the technical aspects and as as much as we can, and hoping that some of the other aspects will follow.
Okay, thank you. We've got another question here. You're quite popular. So in completing a One Health risk assessment, do you end up with a score prioritization for how to respond? So this is a bit more of a technical question, but.
And the framework doesn't follow one specific methodology. So the framework is more about what are the steps for doing a risk assessment, in terms of you have an initiation phase where you have to bring everybody together, ensure you have the right scope, the right question. The execution phase, where you want to do data gathering, whether that be through experts or the literature, or, and then we discuss various different methods, from comparative risk assessment, to foresight, to qualitative and quantitative. But the framework doesn't say there's like one method and you shall only do this. So it suggests that there's a process of figuring out what method to use based on the problem that you're faced with. I hope that kind of answers that a little bit.
I think we have time for one more question that's come in, Dr. Calvin, and I know that there's been so much interest in your work. So, if you're open to it, of course, if you have any other questions, maybe I'll open actually the gateway, I guess. If you have questions for Dr. Calvin that we can't cover during this seminar series, please email them to us, and we can maybe try to address them at a later point in time. But for the last question I have here, how have risk assessment and public health surveillance tools, methods, and technologies evolved to support a One Health approach? And what are some examples that you're aware of, both domestically and internationally, that have been successfully implemented?
So there are definitely some international examples. So we had an international workshop. I guess that was a year ago, February. And so we brought together, for example, the quadripartite partners. They work together on GLUES Plus, the global early warning system. They do risk assessments, joint risk assessments as well. And as well as the Netherlands came and talked about some activities that they've done, as well as the UK. Their HARES group, the Human Animal Infections and Risk Surveillance group, has been working on joint risk assessment for quite a while. So there are some examples. How has the methodology evolved? I think one of the things that's still a work in progress, but we have seen a lot in the literature, is the idea of more participatory approaches. So including more knowledge and input from stakeholders and rights holders into the risk assessment at an earlier stage. We're still sort of figuring out the process for how best to do this, but I think there's other examples in surveillance where that's maybe been done more. So that's, and then, different technologies that can help assist with that can help assist with collaboration and information sharing, different platforms and things like that.
We've got one more question. I'm sorry, maybe we can take one more just because we do have a little bit of time, if that's okay with you, Dr. Calvin.
Sure.
What does success look like in the space of risk assessment if we're thinking a little bit ahead into the future for you, from your perspective?
I mean, to me, success would be that we have the approaches available to adequately address a specific risk question in the best way possible, and using all of the expertise that's available, like being able to quickly bring people together to not duplicate work, and to share information quickly, and to be able to share that analysis with other people. And yeah, I think, to me, and having that longer term look as well is something that we need to be better at, in terms of of looking further ahead at longer term risks, at foresight, and being prepared for the future.
Great. Thank you so much again for all of your responses and again for your presentation, Dr. Calvin. There's been lots of interest in your work and of course on this topic. On that note, I'm going to pass it over to my co-moderator, Wendy, to do some closing remarks. Thank you.
Thank you so much, everyone, for the super engaging discussion session. So we're nearing the end of today's seminar, and we would like to take this time to once again extend a huge thank you to Dr. Calvin for sharing your insights and expertise. And also thank you to everyone who joined us today. We hope you enjoyed this webinar. Please take some time to complete our survey for this presentation, which can be accessed using this QR code up on the slide. It'll also be included in the email that will be shared with participants shortly, so you can look for a link in that email. Your feedback is important to us to help identify areas of success and improvement for this series. You will also be able to request a letter of participation near the end of that survey. Just a reminder that the recording for today's seminar and the presentation material will be made available on the NCCID website in a few weeks. If you have other questions about the Surveillance Advances seminar series, please visit NCCID's website at nccid.ca. And just a quick note that there will be no seminar in July. So our next seminar will be held on Tuesday, August 27th, 2024. And that brings us to the end of today's seminar. Thank you all so much for joining, and see you in August. Thank you again to Dr. Calvin.